vaginal exams. So when are they done? How are they done? And what are they done for? Let's talk about that. So vaginal exams are done for a few reasons, but mostly to check on the progress of your cervix in both its dilation and its effacement. So dilation meaning opening, effacement meaning thinning. So a vaginal exam is usually done with 2 fingers that are inserted. Now your care provider should request your permission and let you know before they're going to do a vaginal exam. And they insert their fingers into your vagina and go, and basically their mission is to touch your cervix with their fingers, and that's how they can figure out just by touch how dilated and how effaced you are. The other thing that they can tell sometimes, depending upon how dilated, effaced, and where the baby is a number called station, and that's where the baby is in the pelvis. So they can sometimes feel where the baby's station. Also, sometimes they can feel when they do the vaginal exam if your amniotic sac is kind of bulging outside of your cervix. They can sometimes feel if that is coming down. They call it a bulging sac. So a couple different things that they can feel and check on during a vaginal exam. So vaginal exams, different people experience them different ways. And sometimes it has to do with the way your cervix is, what position it is in. When you are pregnant, your cervix is usually pointed backwards. So it is during a vaginal exam, it's harder to reach. It's further back. So sometimes the provider feels like they have to reach really far to get to your cervix. Occasionally you'll see providers tell you to make fists, ball your fists up and put them under your hip bones, and sometimes that tilts just right so that they have an easier way to access your cervix. Now, as your cervix changes, either before labor or during labor, the cervix comes closer in so that the cervix is easier to reach, so there isn't quite a reach when they're doing a vaginal exam. What else to know? Vaginal exams are sometimes done in your provider's office prior to labor happening. It depends on the provider and what their policy is and what they generally do. I will say that this is usually an option for people, whether or not you want to choose to have a vaginal exam prior to labor or not. You can usually have that choice if you're in the office. And it's something to have a discussion with your care provider about. Vaginal exams, looking at your cervix ahead of time doesn't necessarily predict when you're going to go into labor. So you could have 0 dilation, 0 effacement, and go into labor 2 hours after you leave the office and after that exam. Or you could be the opposite. You could be 2 centimeters dilated and 80% effaced and not go into labor for a week. So it doesn't tell us a whole lot accurately of when things are going to happen and how fast they're going to go. It just gives us a little piece of information, gives your care providers a little piece of information about what's going on with your cervix. Every time you have a vaginal exam, there is the opportunity, I guess that's the only word I can think of, that it might introduce, the vaginal exam might introduce bacteria. Now, certainly your care providers take caution, they use sterile gloves, but it's just a risk that bacteria could enter during the vaginal exam. And so when your water breaks, most providers will limit vaginal exams so that there is less of a risk of getting an infection during a vaginal exam. Now, oftentimes in labor, when you show up at your birthing location, your hospital, your birth center, they often will do a vaginal exam before you're admitted. That's not every location. Again, something to talk to your providers and your birthing location about, so that you'll be ready and know what is expected. And then Sometimes we'll see vaginal exams done regularly. Sometimes they're done sort of on a basis of like if you're going to make a decision and you want to know your vaginal, you want to have a vaginal exam to know your cervical dilation or progress before you maybe get an epidural or something like that. Other times they'll do a vaginal exam is when it seems like it's time to push. Usually they'll do an exam to check to make sure that cervix is totally effaced and totally opened, so that when you start pushing, there is a clear path and there's not a risk to injury of the cervix or tearing of the cervix. So a vaginal exam is often done at that time. Though there is a very big variety between the number of vaginal exams that happen in care providers, especially if you're looking at like a home birth versus a typical hospital birth with an OB, and midwives are kind of in between. So because it varies so much, it's great to talk to your care providers about what their policy is and what their procedures and what kind of options you have. If you have experienced any kind of sexual trauma in your life, it's certainly something that I suggest that you make sure that your care team knows about in regards to vaginal exams. And if you want to talk that over with them, I recommend it. Definitely make them aware of that. So vaginal exams let us know what's going on with our cervix, what's going on with the baby, and done with the 2 fingers. I get that question a lot in class where someone will say, well, you say it's 2 centimeters dilated. How do they measure it? And it's like, no, they don't have a little ruler that they put up in there. No, it's just they feel and they know by feel how dilated and effaced and what station baby is. So often you have an option for vaginal exams. So great discussion to talk with your care provider about and see what your options are